Hello, dear listeners, and welcome back to the Global Health Unfiltered podcast, where we dive deep into stories shaping global health today. I'm your host, Ulrich Sidney Kamunye, and I'm here with my co-host, Desmond Jumba. Hello, Desmond.
Hey, Ulrich.
Right, today's episode is a very exciting and powerful one. We are joined by one of the most influential voices in public health, whether that's in Africa or globally, and that's Dr. John Nkengasong. Dr. Nkengasong is a Cameroonian-American virologist who currently serves as the Executive Director of the Higher Education Collaboratives and Strategic Initiatives at the Mastercard Foundation. But prior to that, he was the first Director of the Africa CDC and most recently served as the Global AIDS Coordinator in the Biden administration from 2022 to 2025, with nearly 3 decades of service and research in public health. Dr. Nkengasong has been at the forefront of some of the continent's most critical health moments, from establishing the Africa CDC with the new public health order agenda from the ground up to leading the continent's COVID-19 response, and as well as now advocating for a fundamental transformation in how Africa finances and manages its own health future. Today, we'll explore his leadership journey, the future of public health in Africa, and the urgent need for sustainable financing and health sovereignty. Dr. Nkengasong, welcome to the Global Health Unfiltered podcast.
Thank you. Thank you so much. And it's a pleasure to be with you on this platform.
Thank you very much. So we'll start with your journey. Could you tell us a little bit about that process from the start to where you are today, and what drove you each time to take on the roles you did?
No, wonderful. I think, as you rightly stated, I'm very proud of my Cameroon origin. I was born in Cameroon and lived and grew up in Cameroon to the age of 24. I studied at the University of Yaoundé. At that time, it was just one university. And as someone of English-speaking section of the Cameroon, I think we had to go through an uphill task to graduate from the University of Yaoundé 1. But subsequently, I developed a passion a keen interest in medical sciences. And my first encounter in Cameroon, for the short period that I worked there for 1 year, just 1 year as an intern, at the Faculty of Medicine. At that time, it was called QS, under the mentorship of late Professor Peter Ndumbe, was to work on hepatitis B, a virus that at that time was considered one of the most deadly viruses in the world before HIV. And we were looking at the basic question we were addressing at that time was the burden of the disease, hepatitis B, amongst pregnant women in Cameroon. And I would then work with him for 1 year, had the great fortune of having a scholarship to go to Belgium and work with Professor Peter Piot at the Institute of Tropical Medicine in 1989, and arrived there as a young person, 24 years of age, and engaged in virology of HIV, as you rightly stated at the start of this conversation, at core, a virologist. And I would just maybe step back to say that while I was in Cameroon, having graduated from the University of Yaoundé, I was confused, as any other young person would be at that age. And I was talking to so many people as to what I could do next. And I recalled going to meet with Professor Victor Anomangu, who was a former minister and I think vice chancellor of the University of Yaoundé. And I remember sitting in his lab at the medical school, and he looked at me and said, well, virology is very exciting. You could pursue a career in virology. So we left it at that. Fast forward, arrived in Belgium, and as the great fortune will make it, I engaged in the study of virology of HIV very early on at that period, and stayed there 2 master's degrees and a PhD at the Institute of Tropical Medicine and the medical school in Brussels under the leadership of Peter Piot, who later on, 1993, made me the head of the lab. So I was the first African to head a virology lab at the Institute of Tropical Medicine. In the lab that I've trained, came in as a student, grew up in there, had a PhD, and did my postdoc there, and he was so trusting enough to make me the head of that lab at just an age of 32, 33. So I think that introduced me into my management and leadership steps in my career. I did that for just about 2 years. And then I wanted to return to the continent. I have spent about 10 years in Europe, And I went to the library and I remember going to the library. And in those days, of course, you had to go to the library to look for literature, and medical journals will be arriving on a Monday. And that afternoon, I'll spend time in the library. So I turned to the Lancet and I saw an advert there that they want the US CDC, Centers for Disease Control and Prevention, needed a virologist to head their lab in Abidjan, Cote d'Ivoire. Remember that HIV, where we were in the HIV was ravaging the continent. Cote d'Ivoire, Ghana, and other places were like the epicenters of the disease. So I immediately faxed. There were no emails at that time. I faxed my application to the US CDC. And 2 weeks later, I received a call that they wanted to interview me. They interviewed me at the airport in Brussels. I sat there over a couple. We did an interview, and the folks were traveling to the United States from Abidjan. These are the US CDC colleagues. Interviewed me, and I left not knowing what the outcome would be. And a week later, I was called to travel to Abidjan to attend an in-person interview. So that is how I joined the US CDC in 1994. So 1995, I moved from Belgium to Abidjan, set up a state-of-the-art virology lab, and the rest is history. It was the first really state-of-the-art virology lab that we could sequence viruses and know their genetic material. We could distinguish between HIV 1 and 2. We could study the pathogenesis, how HIV 1 and 2 cause diseases. We did so many clinical trials in West Africa at that time. So I think those steps were very important in introducing me into public health. And I always remember Cote d'Ivoire as the birthplace of my life, my journey in public health. So did that for about close to 8 years, then went back to the headquarters in Atlanta. And then PEPFAR, the President's Emergency Plan for AIDS Relief, was launched by President Bush. I joined there as a chair for the Lab Technical Working Group. I remember at that time, the lab capacity on the continent to diagnose HIV was very limited. And I had to set that infrastructure up. And the President's Emergency Plan had very ambitious goals: to put 2 million people on treatment, to prevent 7 million new infections, and to care for 10 million people. And at that time, we only had about 50,000 people on the continent of Africa who were receiving treatment. So how do you move from 50,000 to 2 million people? So those were the very critical steps that at least put me on path, my journey to global health.
Yeah, it's a very interesting journey. I like that you mentioned the serendipity and roles of some of your mentors, like Victor Anomango. I know, as a matter of fact, that you've gone on to inspire people the same way he did for you. I'm thinking about one of my friends, Blake Kemgu, and some other students who were listening to you once. The first time I heard you at Harvard School of Public Health, 2000 talk, and after that, the room was just buzzing. Everyone was like, "No, we have to do something." And everyone was just getting excited. So that's definitely very interesting.
So, Dr. John, I'm definitely inspired hearing about your story and how you, went from Cameroon and then worked with Dr. Peter Thiot and then Professor Peter Thiot and then, US CDC. Can you take us to how that you got involved in the Africa CDC and set that up? And I'm particularly interested also in hearing about a few years back, you ideated and launched the new public health order for Africa. So how do you go from Abidjan to Addis with this idea, this vision for the new public health order for Africa?
No, wonderful. After 30 years or more, I started my career in HIV/AIDS in 1988. I mean, as I told you, graduated in 1987, 1988, joined Professor Peter Ndumbe's group as an intern, right? I've never worked in Cameroon, never. I don't have any matriculation there. So, but when I reflect back, you realize that there are three phases in your career. One is the very technical phase where you're doing what you were trained to do as a virologist, and you do that well. And then you move up to a manager. And because you were doing that exceptionally well, I mean, it's okay, you have to lead a team, you become a manager. But inwardly, you have not been trained to be a manager. So you kind of, you build the skills of being a manager as you work on. You're expected to still be a data scientist, but at the same time to manage people. You do that well, you move up to a policy level. okay, and you keep going. And I think I've done all of those layers. In addition to that, became a diplomat at the State Department, because before I left the Biden administration, I was the ambassador at large and the equivalent of a Secretary of State, the Assistant Secretary of State for Global Health Diplomacy and Security at the State Department. So the way the State Department is organized is that you have the Secretary and then Assistant Secretary of State. So that bureau, because I created a new bureau, I became automatically I operated at that level there. So here you are, someone who was a bench virologist, grew into public health, and then you become a diplomat at the State Department. Now, how do you do that? I've never, ever walked into a job that existed. Never, ever. So when I left Belgium, as I told you, the job was, my first job at the US CDC was in Abidjan. I arrived at Abidjan, and they showed me a dilapidated building that they needed to renovate at the infectious disease clinic at CHU de Trècheville. And they said, this is the lab that we want you to start from fresh. So I kind of look around, look over my shoulders to this guy who was the US CDC director in Cote d'Ivoire, Dr. Alan Greenberg. And I said, but this is not the lab that you advertised in the Lancet. He said, well, I know you see a dilapidated building, but I see a lab. And then he turned to me and said, what do you see? And I said, yeah, I see a lab. And then with that faith, which leaped in that direction without knowing clearly where we are going, we built that lab from scratch, and we published so many papers to clarify HIV. Then I left there. When I arrived at the US CDC, PEPFAR was created, the US President's Emergency Plan for AIDS Relief. I was the first co-chair for the lab working group. There were no labs out there. There was not even a lab at the US CDC that catered for international work for HIV. So I created a branch, a brand new HIV international lab branch at the US CDC, and got it accredited. Then when I stayed there for almost 10 years, I was a branch, which is quite a senior position at the US CDC. Ebola hit, and we all scrambled with Dr. Frieden, who was the director of the US CDC at that time. We fought Ebola or supported the response efforts in West Africa. But it occurred to me that as an African, Ebola shouldn't have been that devastating in West Africa, because it's a disease of contact. It's a virus disease, infectious, but you have to be in contact with the infected individuals. And we know how to contain those diseases. I mean, now it's relatively easier to control Ebola, because you really need that contact to contact, versus a respiratory disease, which can infect anyone. If you cough or you sneeze, it can. So that inspired me. Then as the Ebola crisis was diminishing in 2015, I heard through different channels that the head of states of Africa were interested in setting up a on the continent. I've actually met in Malabo under the chairpersonship of, I believe, President Mugabe at that time, in an extraordinary summit to discuss this establishment of a CDC. So I immediately went to Dr. Frieden, who was my boss at that time, and said, look, I want to go to Africa and help set the CDC up. So he looked at me and he said, do you have a job here? I said, no, I want to go. I really want to go help and support the establishment of a CDC. Look at what happened in Ebola. We should learn lessons from that and see if the continent can have its own institution. He said, okay, good, apply. If you apply and you accepted, we'll support you. Luckily for me, the then chairperson of the African Union, Chairperson Zuma, had signed a memorandum of cooperation with Secretary Kerry for the U.S. to support the African Union to set up the CDC. So I think you can Google and you find out that memorandum of cooperation. So fast forward, I applied. It was not an appointment. I applied, competed, went for an interview. I was selected. Then came back to the US CDC and said, look, we have the memorandum of cooperation. Can you second me to the AU as part of that memorandum? So that happened. And in December 2016, I arrived at the African Union with my laptop. And there was no office for me. The space that I had was not, the table that I had was not bigger than the size of a bed stool. And I sat there with my Apple laptop and started the process with what I call a clean pen and pencil to draw up the organogram, to go through the processes at the AU. I would not have an office for 1 year, and it was in the corridors trying to recruit people to do. But I was very determined. I was very determined that public health doesn't need a lot of fanciful things around. That the US CDC, even though it's a gigantic structure, when it was founded about 80 years ago, it didn't start off being fanciful. So I recognize that my role as a pioneer was that you were going to endure and set up structures, but set up structures that will be strong, grounded, and will be lasting. So did that, started the recruitment process, and I think at that time, the budget that the AU allocated was less than 15 million US dollars. And I met a skeleton staff there of about 10 epidemiologists that the US CDC had supported. They call it the field epidemiology training experts on the continent. During the Ebola outbreak, they have supported the continent with those. So that was my core thing. But fast forward, when I left with a staff of over 319, left them with a budget of about 1.8 billion. We left them with a campus, a whole, if you Google Africa CDC buildings, you see a whole new campus that we established. It's the state-of-the-art campus there. But it just shows that determination and the drive to do things that you believe in and believe in strongly always yields. I mean, of course, you have to, it's more complex than that. You have to build political relationships, alliances, and understanding, because the AU, the head of state hit the gavel and said, let there be an Africa CDC, but there was a very little understanding of the complexities, what that is required for such an agency to be autonomous and do its work. But I would just end by saying, when I left the African Union, I think everybody had a common understanding of the importance of a public health agency. Ambassador after ambassadors and foreign ministers after foreign ministers recognized that. I remember that at one of the meetings after COVID had hit and the way the Africa CDC responded, I had a standing ovation of all the ministers of foreign affairs just to recognize the work that the Africa CDC had done under my leadership. Mm-hmm. So good work always pays and is rewarded, especially when you do that passionately and you do that with no interest. And that is, again, then I left there and went to the State Department, and Biden reached out and said, you have to come back. Remember, I was seconded to go to the AU, said you have to come back and lead PEPFAR. And it was a struggle, consulted with many head of states on the continent, and they gave me the green light, and I left. When I joined the State Department, I was sworn in. Senate confirmed after Senate hearing and confirmation. Secretary Blinken, who was my boss at that time, said to me, look, Ambassador, we will need to add more things to your plate. You are not just going to be a PEPFAR coordinator, but we want you to establish a bureau. A Bureau of Global Health Security and Diplomacy is a big deal. Just setting up a new infrastructure within the State Department of the United States is a big deal. So, I mean, within 1 year, I stood that up. And I'm very pleased today that that bureau has survived and is now a vehicle that has absorbed everything else that came from her, the USAID that has been dissolved. So I think that's the great advantage of having structures that could accommodate that. So again, that's the journey. It's a fascinating journey. We could spend 2 days just discussing the details of each step. I make it sound like you wake up in the morning and you go do those things, but it's really hard work, a lot of work to do. But let me just go back to the Africa CDC. When I mentioned the amount of 1.8 billion, 1.5 of that came from the Mastercard Foundation because of the trusting relationship that they had in Africa CDC. It was the largest donation by a philanthropic organization to a public health agency, in my knowledge, in the history of public health. And all of that was built on trust. It gave power and it gave recognition and credibility to such a young organization. Remember when COVID hit, Africa CDC was only about 2.5 years old. And there are several factors that contributed and made it prominent. One was political leadership, where President Ramaphosa owned that space. He will, every month, you convene meetings of head of states. They call it the Bureau of Head of States, and put me at the middle and the center of that and said, our Africa CDC director, Nkengasong, will tell us where we are with this pandemic, what we need to do, and what are the challenges there. And I would say month after month was heard constantly. He was passionate with that. But just by owning that space, by saying our Africa CDC director or our Africa CDC would guide us, it wasn't about WHO, it was about our Africa CDC. That is a political ownership and leadership that is required. We work hand in hand with President Ramaphosa. He is perhaps one of my greatest public health champions because without him owning that space, it would have been very difficult for a technocrat like me to find my way in the politics of the continent. He owned that. Second is that when you build trust, you have allies and partners. The Gates Foundation was one of those very early partners that came in, especially during COVID, and availed 5 million. It's with the 5 million US dollars that we started training, built training centers for diagnostics in Senegal and in South Africa. And our first training in Senegal in February of 2020 was designed to equip countries that had flights coming from China in Africa so that they could have just 100 test kits, 100 test kits. And after the training in Senegal at the Pasteur Institute with Dr. Amadou Sarr, everybody went back to those countries that we had direct flights from the continent and China, and they were ready to use that. The first cases that were detected on the continent in Egypt were detected with those test kits. Okay, that means that from the training there. So, but because of that, we launched what we call the Partnership to Accelerate COVID Testing, called PACT. The Mastercard Foundation came in and donated 40 million to advance that. We did that very well, accounted for and showed impact. Then they came in a year later with a large contribution of 1.5 billion, which really changed the dynamics and the way that the Africa CDC was seen and recognized and respected in that space. So again, it was a fascinating journey, challenging journey during the COVID response, but that made, I believe, the Africa CDC was a test that could have make or break Africa CDC, but it helped to make Africa CDC what it is today.
Certainly. I think we all agree with that. What is really interesting about your journey, as you said, you've always gone and found and had to build from the ground up. I think it's even more interesting for younger Africans today within the global health space or within development space to hear these stories, because it often feels, the narrative is often one of things are so difficult that things will never change. But to hear that consistently and constantly you've gone and seen something, seen the vision and worked really hard to make it happen, it is very inspiring. And we could definitely stay here for days hearing more about those stories. I am already so surprised at some of the political leadership. I mean, when you spoke about President Cyril Ramaphosa being one of your greatest advocates, and it really is something that I would love to delve in. But you also mentioned that Africa CDC was able to go from the 15 million US dollars to 1.8 billion dollars thanks to the Mastercard Foundation. And that helps us segue into funding health systems in Africa today. So you've warned multiple times that financial challenges threaten to erode all the progress that you've mentioned and been able to accomplish so far in the fight against HIV or other health conditions. What's your reaction to the recent cuts and broader shift in global health priorities?
I think we find ourselves at a crossroads. We, meaning the global health community, at a crossroads because of, I would say, 4 different dimensions that are all operating in an interdigitated manner. First of all is the financing, and I'll expand on each of those. Second is disinformation and misinformation. And thirdly is the geopolitics of where we are in the world today. And then lastly is the shifting priorities. Okay, I mean the climate change and others. So those 4 dimensions, they all act in an interconnected manner, but will define the future of global health. Okay, good. If you look at financing and just look at the numbers from WHO is going to cut its budget by almost 40%. That will have a tremendous impact on the health equity gaps that we're all trying to address. Remember, the sole purpose of global health is to address inequities. That way, shorter person somewhere, shorter meaning just you lack resources, is equipped when it's needed so that they can have proper access to healthcare, right? I think that is the whole purpose of what is driving global health. Global health is security and closing the gaps in inequity. So because of that, I mean, gaps will continue to increase because of the funding. If you look at other European countries, they are also decreasing their foreign assistance and global health investments. The US is not alone. I think you've seen that across the board. That is going to affect, I mean, across the board. I mean, their ability to respond appropriately. At the same time, the needs for global health are increasing. The WHO estimates that just mental health alone, that in 2020, there were about 264 million people suffering from mental health. We all know that by the year 2050, about 39 million people could die of multi-drug resistance. Across the world, we continue to see increasing emerging diseases like COVID, Mpox, that was yesterday very localized, is now spread at some point across the world. Hypertension kills about 10 million people a year across the world. It's poorly controlled in several parts of the developing country. So the needs are huge. Climate is exacerbating the impact. You begin to see diseases that were before restricted only in the tropics, showing up in southern France and southern Europe as a whole. So the world of global health and health security is extremely volatile. Okay, now, and at the same time, you have this decreased financing there. Second is the geopolitics of the world. The war that is going on in Ukraine is making the Europeans focus more in their own, rightfully so, in their own defense systems. And the pot of money has not increased. It's the same pot of money, but you have to shift resources and prioritize them. Okay, whatever. The geopolitics, you see, we are living in the world where it's multipolar. You have the BRICS, you have the G7, the G20, and all these other settings, and everybody has an agenda. Okay, that is not helping. Then the ability to coordinate, if we are more fragmented than we are I'm really hoping that the pandemic accord that was signed in Geneva, just at the last World Health Assembly, will allow countries to share more data in a timely fashion. But that is not obvious if we are not cooperating. I mean, the centrality of global health security is the 4 Cs. We have to be able to coordinate, collaborate, cooperate, and communicate. Okay, that is key. I mean, if we fail to do that, then we are exposing ourselves. Emergence of COVID showed us how connected we are and showed us how fragile all of us are. COVID emerged, and within 2 months, it had affected 165 countries, and it killed or resulted in the deaths of more than 20 million people in just 3 years. Okay, so it shows us how a common destiny, a common fragility, and a common connectivity that we are. So I think those are some of the challenges that we are seeing. Now, what must Africa do? Africa must take its own sovereignty into its hands. This doesn't mean that you should not partner. I mean, partnership, cooperation is always going, and solidarity is always going to be underpinning for an effective global health response. But Africa must show its own commitment that it is. You cannot say that you are sovereign states if you cannot support to a large extent, the health of the most important assets that you have is your human capital, right? You have to do that. Now, the birth of global health is not a very old concept. I mean, the history of global health started from tropical medicine to international health and then to global health. So global health is only really became popular around 2000. So I start there because I want to make an important point that Africa is not so desperate as it was in 2000. In 2000, as a continent, we're challenged with the crisis of HIV/AIDS. HIV/AIDS was devastating the continent. GDP had decreased by more than 2.6 percentage points. Life expectancy had decreased significantly in most southern and Eastern African countries by at times up to 25 years. So let me just use 2 examples or 3 examples to illustrate how since then, because we were effective in fighting HIV and other things, and the economies of those countries have grown. Take Kenya, for example. The GDP of Kenya in 2000 was around $13 billion. Today, Kenya's GDP is around $133 billion. So within 25 years, it has increased almost tenfold. The GDP of Ghana was around 5 million. Okay, 5 billion. I beg your pardon. 5 billion in 2000. Today is around 98 billion. Okay, I mean Cameroon, where we all come from, the GDP was around 10 billion in 2000. Today is around 50-something billion. I mean, because global health is complex, so you can see that I spend a lot of time trying to understand these financial constraints and where the money should come from. So the point I'm making is that the countries in Africa are not where they were 25 years ago, what I call the birth of global health, where the Global Fund was created, Gavi was created, PEPFAR was created around that same period, and with various political leadership, like the Kofi Annans of the world, the George Bush, the Obasanjo, and all these leaders that were around the early 2000s. I must say that the only disease that has ever received a UN Security Council resolution, Resolution 1308, is HIV. HIV is the only disease that the UN had actually hit the gavel and say it's a security threat. But that requires a lot of diplomacy and politics, good politics to enable that. And what did that do? It galvanized the fear. And again, it gave birth to really what I call the modern day concept of global health. The point is that the continent of Africa in 2001 signed or agreed in Abuja that they would achieve a 15% budget allocated to health. I think Africa needs to look back and say, look, we are not so desperate as we were in 2000 when we were hit with a crisis of HIV and other factors. We need to strive to get to the 15% budget level so that we can take care of our most precious assets, which is the human capital or of our people. I mean, Africa is projected to be the continent of the future. It is already the continent of the future. In the next 25 years, short 25 years, one in every 4 people in the world will be an African. 1 in 4 people, the population of the continent will be around 2.5 billion people, and 70% of that will be young people. But if you do not protect the health of these people, then that demographic growth can become a disaster rather than becoming a dividend. So health is transversal in all of this. We saw what happened with COVID. Within just 2 or 3 years, because of COVID, the rate of unemployment increased by 30% across the world, including Africa. Economy loss was close to $16 trillion. It's something that I would strongly urge that African countries consider the health sovereignty very, very seriously. You cannot, and I'll just end here, you cannot cede the health of their people to the outcome of elections in foreign capitals. I mean, it cannot be that. I mean, I think what happened now it's a lesson that during my time as ambassador at US at the State Department, I used to meet with presidents and encourage them that you cannot. Yes, we know what the US government has done since the creation of PEPFAR in 2000, in the early 2000s, but you cannot count on that forever. They met the continent at a point of need. It is up to the continent to determine how to take that fight forward. And hardly did we know that elections happening in the US will completely change the trajectory. But this is a wake-up moment to say, how can I protect the most important assets that I have, which is the people, right? The people capital in my country so that the economies can continue to grow and give meaningful and dignified jobs to the young people that make up the future of the continent.
So I'm curious, why do you think it has taken so long for this conversation around Africa's health sovereignty to become so dominant, right? Is that primarily as a result of this, USA, United States global health funding cuts, or is it something else? Why? Clearly, 10 years ago with the Abuja Declaration, there was some discussion around it, but very little action towards actually achieving African health sovereignty. But now there seems to be more discussion around it. So why do you think it's taken this long?
I think for everything, good public health or global health, Desmond, is good politics, right? I think I've given you examples of in the early 2000s what happened. I mean, with a combination of President Bush, President Obasanjo, Secretary General Kofi Annan, at that time, Secretary Colin Powell, all working together to drive that. I think you need to have such leadership. It's not enough to gather in a capital in Africa and hit the gavel and say, hey, look, we are going to achieve or allocate 15%. You need some championship. Political will and political commitment are so important. But you see, some countries have achieved that, right? In Africa, like Rwanda. President Kagame is leader for the African health financing, is doing a marvelous job at mobilizing and has remained consistent. I was at the AU I believe that was in February of 2018 or so, where he launched the African Leadership Group, which was aimed to mobilize financing. And it remains so. I think that means, so the point I'm making is that you need political commitment, you need political will, and you need political championship. All three must come together to drive this. But it doesn't matter where where the continent has been. What matters now is how do we move forward from now, given what we know. I've outlined for you the threats that we have about global health. I call it global health 2.0. Where do we go from here? It will require resources, domestic resources. Only domestic resources can sustain the gains that we've made over the years. Only domestic financing. The rest of the funding that comes from outside must only supplement the domestic financing. So I think that's why during my time at the Africa CDC, I promoted and advanced the concept of a new public health order. Because when I arrived there, I saw everything that was happening. Remember, COVID has not hit us, but I look at, as a virologist, public health expert, infectious disease expert, I look at the dynamics and I said, it wouldn't be long from now before we are hit by something big. And I said to myself, Ebola was a signal that something big was going to come. And again, I'm sorry that I was very prophetic that a COVID hit and became even bigger than that. So it became to be very clear to me that I wrote 2 papers, one in the Lancet Global Health and one in Cell, which are very prestigious journal. I think the one that I wrote in 2017 in the Lancet was my very early days at the African Union. It was very clear to me that Africa needed a new direction in several dimensions. First of all was their own financing. Okay, if you look at the 4 or 5 pillars of a new global health order is you must finance and you must work with the private sector as well to raise funding, because we know that health or disease threats are not just a social issue, it's an economic issue, it's also a national security threat. So it must really a government commit, but governments cannot do that alone. You work with the private sector. You have to build your workforce. You have to work in manufacturing and manufacturing your own diagnostics, therapeutics, vaccines, right? And then you also have to build your own networks of national public health institutions across the continent. So those were some of the elements that are advanced. And then COVID hit. I was just highlighting Rwanda as a country that has met and exceeded its 15%, and also recognizing the work that President Kagame has done as a champion for health finance in Africa and continue to do so. Because he's a firm believer of that investment in health is that putting our money into health is not just expenditure, but it's an investment, because rely on good health, right? So I also talked about, so that led me to that the new public health order, which I think the rationale behind that was that you cannot. So I arrived at the AU in 2017, wrote the first paper in the Lancet Global Health, and then refined that for that, I think in 2020 in Cell, kind of with the clarity of what was going on. And it was very clear that the continent needed to do a series of things. One was to increase manufacturing of therapeutics, vaccines, diagnostics, because of the scarcity that I saw that drove the inequities in access to vaccines, therapeutics, and diagnostics during the COVID. The second thing on that public health order was domestic financing and working with the private sector to increase funding for health. And of course, building the public health workforce. And lastly, the networks of institutions, public health institutions across the continent. I mean, keep it very simple. Those were the central elements that constituted a new public health order for the continent. I'm very encouraged that Africa CDC continues to write on that. I think that's the right thing to do. You need that at any rate when with all the challenges that I just outlined that the world continues to face, mainly Africa, because look at Ebola. Ebola outbreaks have never stopped emerging in Africa. As we speak, I think there's an outbreak going on in the Congo as well, and they're occurring frequently rather than only occurring every after 10 years or so. I mean, previously it was like an outbreak will happen now, then 5 years later or 10 years, but it's occurring almost every year. Now, that's the reality of the continent that we live.
Thank you, Dr. John. So I'd like us to turn our attention to your new role at the Mastercard Foundation. This role seems a bit different from, the previous roles that you've been telling us about. So would you mind sharing and letting us know how your new role as the Executive Director for Higher Education, Collaboratives and Strategic Initiatives fit into this vision of a sustainable Africa?
No, absolutely. I mean, on the surface, it may not be very visible that this role is actually part of continuation of the work that I've done previously, and I'll unpack that. But it also is very directly connected because the higher education piece deals with strengthening universities so that they can be more innovative and entrepreneurial in spirit, and also more creative, create more creativity there. So I think I've always wondered what my next chapter in life will be. And I think I've always, without knowing that this will happen to me, that I'll have this great opportunity, that building capacity for the future was always on my mind. About after 30 years or more U.S. government, what will I do? And I think the Mastercard Foundation provides such a wonderful opportunity to strengthen universities. Remember, the new public health order talks about workforce development. Okay, I think that is key. And so here you are preparing workforce development for the future, and that can transform the continent. I'll give you two examples. And because we have to solve these health problems and other development problems in a holistic way. Give you two quick examples so that you can to ground this. I'll use two countries very quickly to highlight this, and you can see identify many others. South Korea. South Korea in 1955 has just emerged from the war. I mean, it is like Seoul, where just more or less very poor neighborhoods. I mean, right? And today, look at where they are today, right? What happened in South Korea? That they were very intentional in saying, we will reform our universities, okay, and we'll build partnership with the private sector, and we'll reform the curriculum so that it can best respond to the developmental needs of the country. And very quickly, over the last 1955 to now, transform from cities that were slums to modern cities. But they did it fundamentally looking inward and looking outward. Inwardly, they said, we want to solve a problem, but we also want to be the innovation hub of the world. And today, you have an iPhone that is Apple, you have a Samsung, you have a TV that is Toshiba, you have some. So you have nearly everything, not just in technology, but also in health and medicine, vaccines. South Korea produces more vaccines, but the fundamental and underpinning of that is that they strengthen their higher education, polytechnic universities and other higher educational learning, and oriented them towards innovation, entrepreneurship, and this is where they are today. Their GDP in 1955 was around $64 per capita. This is per capita, and today their GDP per capita is around $37,000. Per capita. That's South Korea. You say, well, let's see, is there another example, John? Yes, Singapore. Singapore in 1980, very, very recently, was a fishing village. Okay, I mean, and look at what Singapore is today, a city-state, with everything that you can admire. It functions best than anything that you can think of. The best airline, innovation, in entrepreneurship, and the hub for everything that you can think of in the world. The GDP at that time was our $5,000 per capita. Today is way over. I mean, I can't put a number there, but it's way over thousands now. And in Singapore, they did the same thing. They reformed their university education, break up from colonial. I mean, I urge you to read the history of educational transformation in Singapore. Completely transformed that, departed from colonial trainings into this. Just two examples to connect back to the Mastercard Foundation and say that's the kind of work that is fascinating to me. And that if I can do that in the rest of my career, that would have been a very meaningful contribution, because we have to build leadership for the future as well, right? The second thing that is not known in the title of my work is the collaboratives. I mean, in there, you have a lot of health. I mean, we're doing community healthcare workers. We're doing a network of universities that are focused on pandemic sciences. We have a network of universities that are dealing with African health workforce development. So there's a lot of a network of universities and institutions that are looking at pathogen genomics. So you can see that there's a lot of health things that are still going on there. And then lastly, the Saving Lives, Saving Livelihood initiative, which was a hallmark program supported by hallmark program of Africa CDC, supported by the Mastercard Foundation. So, I mean, it's all still related essentially. And even more, I mean, the climate collaboratives, I'm overseeing those. So it's very, very exciting opportunity. And that's also the beauty of the Mastercard Foundation, because it's very horizontal. It's not very vertical in focusing in only one area. It triangulates and speaks to each other. the developmental need. But the most exciting piece is the higher education piece, because if we have to solve the health issue, it has to be holistic. Imagine if we transform the higher educational system in one or two or three or five countries, and they are producing top-notch young people that are generating things and developing, like Korea or Singapore or China. Remember, China just until 40 years ago was a very, very consumer-oriented society, and look at where it is. So the prospects are very, very promising, but we need to be resilient. The same resilience that we use in building public health networks on the continent, we have to apply that in developing higher education and institutions networks across the continent.
As you mentioned, the overarching theme of the future of Africa and some of the challenges that are out there to be solved, and the opportunities that are presenting themselves for young African, whether it's public health specialists, physicians, healthcare workers in general. What would you say is your advice in terms of the skills that they need to get, as well as where they should be focusing their energy right now to be ready for that Africa for tomorrow that you're describing?
I think that if you ask me what is you always start with the challenges, okay, that we will face. I mean, the challenges that I face when I describe that young student graduating from the University of Yaoundé and meeting with Professor Nomangu were very different from the challenges today. As a young person today, I can see the following challenges. First of all is the fourth industrial revolution, digitization, technology, of course, AI. If I'm a young person, I will have to be literate. And more than that, with AIs, because that's the future, and it's going to be overwhelming going forward. So do not be left behind. Okay. Second, the impact of climate, green energy, green economy. I mean, it's going to be extremely important, and circular economy as well. Thirdly, is about food insecurity. If you unpack that, you amaze you, especially you being a Cameroonian, that the amount of food that you think you have in Cameroon, how much you still import in Cameroon to feed the masses. The food insecurity is going to be important. And lastly, the industrialization as a whole. The continent of Africa cannot evolve if you continue to export all the raw materials. For example, everybody talks about critical minerals now, but you don't. You are on the losing side if your own role in the ecosystem of rare minerals is just to dig them from your soil and export them to other countries. You have to really have the value chain harness in all of that, and that also includes the existing products like chocolate production made from cocoa beans and etc. So I think that all has to come together for a young person. So I'm a young person. I'm looking at all these dynamics and say, where do I want to position myself to be relevant in the future? And this is just some of the areas that will define the future going forward. The continent of Africa will integrate more going forward through the Continental Free Trade Agreement. If I'm a young person, I should be asking myself the question in Gambia, what is it that I can produce in Gambia that I can sell in Mozambique? Okay, because this would be the largest free trade area in the world. But in order for the young person to benefit, you need to know what is in for me. What are you contributing? Okay, there's a lot of great innovation, startup technology, and different innovations that can really be used across the continent and exported outside the continent. Remember, I would also just remind you, or probably leave you with this, that for the continent to develop, you have to look inward but outward. No country in the world has developed by only looking inward and solving its own needs. You have to look inward and outward. I mean, China became the kitchen of the world, not by just solving its own problems and producing what it needs, but also producing the needs of the world. Okay, and that is what the continent should do as to meet the 21st century goals. I think, again, if the young people can think of that, when I talk to young people, often their tendency is always, we'll do this because we want to solve our needs in Cameroon. Yes, you can solve that, but also think of exporting what you have to across the continent, or especially across the world. I was in Kenya as part of our university, Uganda, part of our university programs at the Mastercard Foundation. And I saw a young person that had benefited from the Mastercard Foundation work and innovated an irrigation machine that didn't need power. So all you needed to do was to take this machine, or this device rather, put it inside water, and it just keeps turning. As it turns there, it just pumps water, and you can use that water in irrigation. Then the question you ask yourself is, it's not just Africa who needs this. I can export this to any part of the world, including in China, India, and so the question now becomes, how do I package that in a way that into an Amazon.com like, so that I can put that online in a platform, digital platform, and somebody in Pakistan and Indonesia can also just order it. And that's how you generate jobs locally and then and encourage improvement. I also saw a device in Uganda where they produce, it's almost like a desiccant, right? Where you can use this in preserving tomato and farm produce. If you drive around the continent in the evening around 5 or 6 o'clock, my heart breaks because you're seeing these women sitting along the road with tons and tons of tomatoes, mangoes, and you know that not survive overnight, but they've traveled long distances during the day to bring this in. But at 5 o'clock, they're sitting there with these things. Imagine if they had a way to preserve this, okay, and you just sprinkle that little device, which is a simple process that says, I understand how food get rot, and I'll divide a process that will interfere with that enzyme so that that enzyme cannot create a tomato it can prevent tomato from rotting before the next day, can at least preserve it for 4 days. You miraculously change the outlook for that woman who has been in the remote areas trying to bring tomatoes to the city. Now, the question is, that technology is not only useful for Cameroon, but it's useful across the continent and useful across the world. That's the kind of thinking that I encourage the young people to carry with them when they think of their future. Thank you. Thank you. It was a pleasure.
Thanks, Eric.